Good, good. Okay, so it is my pleasure as chair of the Roundtable Committee to introduce Dr. Nupur Verma, who is going to run today's roundtable of resident engagement in the post-pandemic era. Thank you.
Thank you, Carolyn. I hope you get well soon. And thanks to our audience for joining us today. I wanted to propose and do this topic on resident engagement in the post-pandemic era because I feel like we've all lived through a very traumatic time and we have a lot as program directors to learn from one another. And I picked engagement because it is such an important part of our radiology community. And I think we do it very well at the APDR level. It's an emotional connection and a commitment that makes the job more than a 9 to 5. And I think that truly speaks to what a residency experience is. It's more than a 9 to 5. It should fill a trainee with pride and enthusiasm and a desire to do more than just, show up for their shifts, especially in radiology, read their reports, go home, pass exams. It's an attempt to make the experience more holistic, more of a lifelong process, and to engage them beyond their daily workload to not just improve themselves as a clinician, but also lift up their classmates and leave a lasting legacy on the program. And engagement is truly a departmental issue. It's not a human resource issue. A lot of non-radiology employment positions will say, well, employee engagement is a human resource issue. At the radiology level, it's a departmental issue because we are burdened with an ever-increasing clinical workload while we're also trying to manage an incredible cut onto residency time through other aspects like exams, requirements for milestones, and by ACGME. So somehow we have to carve within our existing constraints more and more time for engagement to keep our trainees engaged and to fulfill their desire to be a part of the program and a part of the family in a greater than clinical sense. And it is important that we do carve out this time and we fight for this as program directors or as faculty in radiology programs, because we know from other industries, employees or trainees that are engaged are going to perform better. They're going to stay longer in the institution. So that's where I think SCARD and some of our society and sub-society programs are important. Recruitment relies on engagement. And those trainees have less burnout. They rate having a better experience in residency, having a pride of their residency, having good memories to share with future residency candidates as well as their peers. And this is really the worst time to talk about engagement because we're all incredibly burnt out. And a quote from Jeff Bezos came to mind. He, famously said at the beginning of the pandemic to the employees, we all need to work a little bit harder. People are relying on the Amazon Prime delivery to make it through life. Like, you have to give a little bit more. We need 20, 25% more. Well, we were fine with that in 2020, but as the pandemic dragged on for 2+ years, we really depleted our engagement reserves. We're all very exhausted and we're finding it harder and harder to give a little bit more, stay a little extra, do an extracurricular activity. So it's important that we recognize that fatigue in ourselves and in our trainees, and we try to overcome that by creating a structural program within the department that engages trainees and engages faculty to a level beyond clinical care and education. We have 3 excellent panelists today, and we'll allow the audience some time to ask questions and to answer and comment on any of the questions that we'll be posing. And we're going to start off by splitting this into 3 different types of engagement. The first engagement is going to talk about program level engagement. So trainees, want to attend a program that has multiple facets, that has rad aid, that has outreach clinics, but they play an important role in making sure these programs survive. And I would argue they play an important role in creating these programs, staffing them, leading them, and passing them on to the next generation of trainees behind them. A program director alone cannot sustain the multiple facets of a program. The second part of engagement will cover engagement in a clinical sense in terms of virtual readouts. How do we engage with trainees in educating them from a distance in a hybrid format versus in person? And then we'll close by talking about engagement in the sense of a more social perspective. How do we connect with the trainees as we, go through a period where we're increasing diversity and we might have trainees at different paths in life, trainees that don't have family members close by, or trainees that come from backgrounds or interests or hobbies that are a little bit different from ours? How do we draw a diverse group of people in and help find common ground to enjoy the next 4 years? So first, we'll start off by talking about Residency Takes a Village, Residents as Leaders in Program Initiative. And to give us some comments on these questions, we have Dr. Roopa Ram joining us. She's a program director at University of Arkansas. Thank you so much, Roopa. And I really wanted to have Dr. Ram talk about this because she has done an excellent publication and discussion on life after residency training, assimilating new practice ideas and adapting to new skills and new surroundings. And what better new surrounding to adapt to than the pandemic and radiology residency? So Dr. Ram, please.
Thank you, Nupur. Can everybody hear me okay?
Yes.
Okay. Happy to be here. Happy to actually learn from you all and excited to hear what comments everyone has because this is an ongoing process. I am 2.5 years into this job and I have plenty to learn. I just want to share some of our experiences, things that have worked for us, things that have not worked for us. So some of the resident-driven initiatives that I think have worked for us are, we've had the R Force who've taken it upon themselves to do an year-round curriculum for the R1s. So this is an idea that came from them. I didn't ask. Initially, faculty were doing it. And during the pandemic, the R Force that year came around and said, hey, can we take over? We all save interesting cases. So these teaching files are already built in our profiles. All we have to do is show them the cases, teach them at their level. And I think they would learn better coming from an R4 than from an attending. So that's something a bunch of them started in 2019 or 2020, I want to say, and that's just propagated from them. So that's now a thing where the R4s just teach the R1s every Monday from 7 to 8 a.m. Something based on that, something else they started this year too was they started a multiple choice question conference every Wednesday morning. So they told me it's one thing you teach us how to read cases, but nobody ever teaches us how to take a test. So test taking skills are an entirely different experience. So some R4s now have volunteered to teach this multiple choice question. So it's easier when things come from them. I think they carry through forward, even if you have 3 or 4 motivated residents who do this year round, that propagates without dying out. Some other things which I've kind of made them do is I've assigned them monthly lectures to do for the interns. So the R1s, the interns, not even R1s yet. So the interns who rotate at various hospitals because we have a transitional type here. So the R4s are assigned by me to do a lecture for them on a monthly basis. They don't complain too much about it. It's about 2 lectures a year. So that's something I've made them do. And the other thing we've given them initiative to take care of is M&Ms. The chiefs have mostly done the M&Ms. So those are the 2 things we've assigned. And the first 2 things I talked about, the residents have done on their own. We are in the process of setting up RAD8. And this again came from the residents. They were willing to put the work in for it. And so we'll see how that goes. And for those R4s that have taught the most at these R1 curriculum conferences or at intern conferences, I do try to incentivize them at graduation. Just a little, pat on their back.
Is the incentive financial, time-wise?
Not time-wise, just more of a recognition.
That's really helpful as well. Do you recruit for this need when you interview future radiology resident candidates? Do you recruit for this interest? Is there something in the ERAS application or any questions you ask to make sure these excellent teaching programs are sustained?
So a lot of the applicants want to teach. So we've kind of advertised even during recruitment that we actually have an award or an incentive or a recognition for the resident that does the most amount of the best teaching as a resident. So that's something I intentionally ask them and try to get a feel for, okay, will this be a resident who will just do his job and be out, or will he go an extra mile and maybe help? So there is some intentionality when we recruit, whether it's successful all the time or not.
Whether it's successful or not, that's absolutely right. I think that's something that program directors struggle with a lot is when you're looking at ERAS applications, everybody has taught junior medical students, everyone has done community service clinic, and when they come to residency, it's just like R1 day 90, everybody's exhausted and stops engaging with the program. So I have a couple ideas that are suggestions to how to improve this kind of educational or program management engagement. One idea is doing an R1 job rotation. So a couple industries like the Heineken Beer Company or the NFL do programs that have new recruits into the career realm do job rotations for the first 6 months. So for example, in Heineken, they'll work in bottling, packaging, marketing, they'll go to board meetings, and they'll kind of get a feel for what they like. And hopefully something will hit a chord and they'll say, oh my gosh, I love Heineken marketing. And the NFL does this as well. NFL has a whole department that's dedicated to travel management for sports teams. So you might be applying to the NFL for a marketing gig, but you get to do travel management, you get to do vendor relationships, you get to do financial aspects of it and ticket sales. And by forcing people to kind of job rotate more than just a rotation in terms of clinical sense, and having them have a senior buddy, I think can help sustain some of these programs. So Dr. Ram touched about having, senior residents teaching the 8 to 9 session. So faculty have to kind of let go and step back, and they have to be okay with letting residents lead it, and the teaching not being perhaps as perfect as if your best faculty did it. But if you don't let go of that, you don't let that confidence build, you're also not going to have the opportunity for residents to step up. The first time you cut a trainee off and you say, no, let me do it this way, or we need to do the multiple choice conference this way, they might just say, you know what, I'm busy enough as it is, so I'll just stop doing it. And that kind of can be a subconscious conversation for the trainee as well. And I love your recognition. So they have found a praise to criticism ratio in employee engagement that's the most optimal is 5 to 1. 5 times the praise to 1 criticism. So I don't say that you have to kind of strictly stick to this, but you can say, I noticed the teaching conference was a little bit short today. We really need you to fill up the whole hour. But then at the same time, hey, that was an excellent case of epiploic appendicitis. I really loved how you engaged the medical students. You were really well prepared. Thanks for bringing the ultrasound image of appendicitis before you showed the CT. There's lots of opportunities to give positive praise, and that can kind of help build trainee confidence as well. Another thing to consider when you're building trainee engagement is the program next door. So if you're trying to build something like RAD8, is there a geographic program or a sister program? And it doesn't necessarily have to be close. Now that we're so Zoom facile, you can pick a program that has RAD8 and say, hey guys, let's attend UF Jacksonville's RAD8 program this month. Let's see how they do it. Does this spark an interest in somebody? Is someone wanting to take this on? And then the faculty buy-in is really important. And when I'm talking about faculty, not just program leadership, just kind of opening this up and praising residents also lets faculty see, hey, I'm looking for more engagement in my mid-career, my late career phase in terms of outreach to Guyana, or in terms of, being engaged with ultrasound clinics. So including those faculty can kind of help alleviate some of the burden on program directors that are trying to increase resident engagement. And one of the best rewards is going to be time affluence, giving trainees time. And I know this is, fraught with its own challenges in day-to-day clinical burden programs, but giving time that is even very minimal, like the 8 to 9 protected time you're talking about, Roopa, where that is teaching time. I'm giving you that. We as physicians are working hard as faculty to take care of the caseload, so you have that protected time. Expressing that time affluence and investment in our program can be really powerful as well. So thank you. Does the audience have any comments on this topic, or does anyone have any hands raised? We'll save some time at the end as well, and you can pose questions to Dr. Ram or any of the other panelists. Next, we'll jump over to Dr. Christine Rehwald. And so I picked this topic because I think it's just something that I've seen change in trainees and how they accept it. And we were talking before this panelist started that maybe the trainees that were opposed to hybrid or virtual have just graduated, and the new era are used to like online dating and all this other stuff. So they're like more, I guess, cool and comfortable with a hybrid program. And Dr. Christine Rehwald is going to talk a little bit about this. She's Program Director of Diagnostic Radiology, and she's done some work with the Veterans Affairs in terms of quality improvement and making long-lasting qualitative changes, which if pandemic and hybrid education is anything, it's a long-lasting qualitative change in the way we educate trainees. So please, Dr. Rehwald.
Thanks so much, Nupur. Nice to be here. Thank you for having me. Again, my name's Christine. I just took over as PD in October, so I'm pretty new. Prior to that, I was one of the associate program directors. So yeah, with the virtual readout hybrid model, I'd be really interested to hear what other programs are doing. Obviously, at the beginning of the pandemic, it was clear that we were going to have a remote sort of virtual readout experience. I mean, our residents were on site, but many of our faculty were not. And just to allow space in the reading room and keeping our distance, everything was done via Zoom or some other method. I think by and large, our residents are young, they're adaptable. They were okay with this sort of setup in general, and they're more tech savvy than many of us. And so I think all in all, it went okay. It did have its problems though. I'm sure everyone at your, the same scenario at your institutions where, some faculty are very facile and tech savvy, while others are not. And so we had sort of a disparate experience depending on who was doing the virtual readout. And it was difficult for some. Obviously, it was easier for our more senior trainees, who've been around and can more easily, have a quick and more efficient readout session virtually. But certainly for our juniors starting out, it was difficult. And we had some morale issues with them and getting them up to speed. Setting expectations, this is something too that'd be interesting to hear how others do this. Again, at the beginning of the pandemic, it was expected that we were gonna have to adapt to a virtual format, and everyone did that pretty seamlessly. But then we get into the sort of gray zone of, we're back now in person. Most of our faculty are back, and most of our readouts now, I would say actually virtually all of them now, are done at the workstation in person. And I think that this has been a good thing, obviously, for trainees and faculty alike. And, I think residents are on board with this. So while they may have gotten comfortable to a sort of virtual format, I think most are happy to be back in the reading room. For lectures, that's sort of a different topic. I don't know if we're going to get to actual didactic lectures, but that's a whole different opinion there. And, again, in terms of acceptability of having a hybrid or virtual readout model, I think it's difficult because it really depends on the comfort of the faculty and the comfort and level of the resident. And I find that, it was too variable at our institution. Again, our senior residents were fine. Some of the faculty were fine, but it was difficult for our junior residents, and it was difficult for our faculty who were not as comfortable with the virtual setting.
Absolutely. Were any faculty excluded from doing virtual readout? Were there any like worker bee faculty where, today's your work from home day, you work, you keep, you read the more mundane cases, and you clean up the less desirable, less educational worthy cases, and you don't get to virtually read out? Should any faculty be excluded from that because of their either lack of technology or lack of ability to effectively engage virtually?
Yeah, yes, absolutely. So this is actually happening now. So most of our faculty are back in person now, but we do have some faculty who read mostly remotely or entirely remotely. And those faculty, like you said, are picking up sort of the low-hanging fruit, not reading out remotely, just picking off studies off the list. It sort of depends on what section, how they manage that, and how they manage the volume. But we're really encouraging that the faculty on site are the ones participating in readouts with the residents, not the virtual or the remote attendings.
Absolutely. I think that's perfectly fair. And I think that's how most organizations are doing it, is they have on-site faculty that are reading out, and then they have virtual faculty that are either cleaning up the list or virtual faculty that are engaging with residents. If you do have virtual faculty engaging with residents, setting expectation, I think, is really important, not just for the trainees. Like if readout is at 7:30, they know to be ready with your cases at 7:30, be logged onto Zoom, make sure you're dialed in or your microphone's working, your headset is on, make sure your colleague is seated and ready to take those protocol questions and help the technologists. But that the faculty also shows up on time, so you don't have like a panic attack and chaos every morning. It's also really great that you pointed out it should vary by trainee level, because teaching X-ray on Zoom is virtually impossible, whereas teaching CT on Zoom is a lot easier. You've got slice positions, numbers, you can scroll through it. Sometimes radiographs don't transmit, and I don't even want to try to attempt teaching mammography on Zoom. I think that would be nearly impossible. So it can depend on the modality, resident trainee level, but also on the faculty. And I think as programs, what we can do is focus more on the faculty level. And there's a couple different ways to split this. I do think we have to all consciously think about remote and hybrid approach, at least for the next 5 to 10 years, because we are struggling with radiology staffing, even at academic institutions. I think this used to be kind of a private practice problem where they just absorbed the volumes by working harder and working longer. But from the faculty level, we don't really have a lot of reserve to give in terms of clinical time. So we may need to be a little bit more hybrid in our approach to recruitment and retention of faculty. And a couple ways that I've seen this being approached is like, for example, Tan can comment on this in the chest section, 2 on-site faculty that do all the resident readouts, 2 remote faculty that are doing all the grunt work of the more boring ICU films and the outpatient lung cancer screenings, and then communication guidelines for faculty. So I have some very interesting comments from trainees because we went through a hybrid change. And one of the comments that really lasted with me is, I feel so lost and I don't want to bother this person. It takes them a long time to reply. They tend to fix my reports and I never hear from them. And that kind of shows that telling faculty, like, you don't have to log on to Zoom for every minute change. So there are 3 rib fractures, you added 2 more. You don't have to log on to Zoom, but you can text the trainee and say, just FYI, great job on catching those rib fractures. There's also fractures of 8 and 9. I placed arrows on them. And sometimes those quick little feedbacks let the trainees know that you're actively engaged with them, because sometimes they might feel that if you're not physically there, you may be riding your bicycle outside in the sunshine. So I think just that kind of active day-to-day engagement throughout the workflow is really important. And then an interesting comment I had from a junior resident was that I don't mind virtual readouts with Dr. X because they're organized, paced, and he texts me when I'm supposed to log on for readout. So that faculty's approach was to read out the trainee on call at set times at 11 o'clock and 3 o'clock and log on to Zoom and just go over rapid fire the 12 cases they made changes on. Like, look over here, do you have any questions on that? Or do you see this intramural hematoma? They would text them articles to read after their shift. So sometimes it takes a little bit of faculty training as well to kind of make that hybrid or that virtual approach work. It would be great if we can return everything to in-person. I just don't see how we can do that with the radiology staffing issues, and then also with the pandemic and now the tridemic going on. I think things tend to ebb and flow, and we can't really lose the workflow if they're not able to come in if they're not feeling well that day. So communication guidelines for faculty can play a really important role. And this is actually a picture from an airport in New York, which has like over information. I think this is what we have to tell our faculty: over information, times to read out, how long you can wait to, I'm really busy right now, I'm going to go do a biopsy, I'll read you out in 1 hour. I've made minor changes on your report, I need you to review them, and we'll review pertinent changes at 4 p.m. Over communication in terms of time can be really helpful for residents. Some residents have commented that they do enjoy the autonomy. They do enjoy feeling like an attending during that time. And those comments are usually from senior residents where they don't feel micromanaged or interrupted. Sometimes they can see minor, like, hey, there's a 5th rib fracture. Okay, well, that was a kind of an interruption in my current case. So depending on the level of the trainee, the perspective can also change. Tan, you have a comment?
Yeah, I wanted to make sure that I unmuted myself first before I do the usual Zoom thing that most faculty typically do. I wanted to say that a lot of places now that we've switched to somewhat of a Zoom format, we will have some sort of virtual communicator system that's already in place. It's almost near real time, and probably real time in a lot of places. You can communicate directly between faculty and residents and say, hey, I have a question about this case from a residency perspective, or from a faculty perspective. You can provide that feedback that's definitely necessary to help trainees if you're going to be doing remote readouts. Mm-hmm. So I think that's another what's the word I'm looking for? It's another opportunity, if you will, to kind of communicate with the residents without having to get on the Zoom chat. You can also just do an instant communicator as well.
Yeah, I prefer that for small changes. I think it's less disruptive to their workflow too. They can continue with their current pace, then reload. And I'll often say, like, no big deal, or just FYI, or, want to make sure you see this minor change. It doesn't change management, but you need to know it. And not just letting the resident know that something was changed or added to the report, but that perspective of you are getting feedback on your study. You know, you are being dynamically engaged with every 30 to 45 minutes. And it kind of clears up mental space for me as well, because I don't have to remember at 3 p.m. to go over the 15 minutia changes that I made for the last 6 hours. We can focus on the 2 or 3 big teaching cases. And then one thing I find really helpful for virtual readouts has been bringing my own interesting cases. It's amazing how bringing just 2 or 3 cases that you've read that the resident was not exposed to, that have good teaching points, helps kind of cap off that virtual readout. You know, once we've gone over their changes, done a little bit of criticism, hurt some feelings, here's 2 or 3 really cool cases I got, or here's a really good catch from other attending on a prior read that I want to show you. So kind of ending on a high note and on an educational note can be really helpful to kind of wrap up virtual readouts as well. We have several attendees. Do any of the attendees have experience with virtual readouts? Are you doing it right now? Are you succeeding? Do you have any tips for our group? Please feel free to raise your hand. I'll continue in the interest of time proceeding through our slides, but feel free to raise your hand and I'll call on you so we can get your perspectives as well. Our third and our final segment of resident engagement is social engagement. So, you know, loneliness is an increasing problem. It's only increased during the pandemic, and keeping it social in training programs is really important. And Tan, I'm going to have you speak on this. Dr. Tan Mohammed is professor of radiology, and he has a special interest in diversity, equity, and inclusion, especially at the medical student and radiology recruitment pipeline level. So would you please talk about social engagement in the post-pandemic era? What are program responsibilities? What should we be doing? Do we even have a responsibility to trainees in this regard?
Thanks, Nupur, and thanks to the APDR for actually hosting this event, because I think it's hugely important. First of all, I'll say that engagement is inclusivity. So I think we have to kind of almost run them in parallel. And I think that all of our efforts and good work to kind of foster diversity will be sabotaged if we don't create any sort of Department of Well-being, any sort of supportive environment for all of our trainees. And we have pretty much an obligation to provide the social framework that you've already described for us very nicely and eloquently, that kind of forms the connections that go beyond just the mundane residency training, if you will. How do we do this? I think we have to acknowledge the social demographic backgrounds and complex relationships that happen between work and family relationships of our trainees. For example, at the University of Florida, where I work, we have residents that have special interests, such as bird watching or yoga training or reading non-fictional books and what have you. And certainly, thanks to COVID, we've had a lot of isolation from that. But I think if we try to pair residents or in faculty and residents, if you will, together with one another, to say, oh, by the way, I also have an interest in bird watching. Oh, I like to go and do yoga as well. They can form little small groups and teams that are now able to kind of get out and do these sorts of things to kind of help strengthen the bonds, again, that go beyond just pure training. Yes, as I mentioned earlier, COVID has really caused a lot of increased isolation in not just trainees, but also in faculty members. We kind of have to work to try to break down those barriers. And it's not a huge financial buy-in for various departments either. They can have like just group walks or go to some sort of community functions that are going to be available in and around your respective areas. I think those sorts of things build esprit de corps amongst people and certainly help to strengthen the bonds of diversity that you would not otherwise have the opportunity to participate and do.
Absolutely. And, you know, this is actually Mike Tyson. I didn't know he raised racing pigeons, but it kind of shows how we all have such diverse interests we would never know about. And it's one of the things I love about APDR. Every time I go to AUR, I learn, you know, last time we had a really great arts and radiology small group. I've learned that there are people who can design their own outfits. I've learned that there's people that are so musically gifted, and it's just wonderful to learn from the community that we're in, all the wonderful talents and hobbies we have. And I think we need to make an effort to learn that about our trainees. You know, belonging is a biological need. This is a pre-pandemic number. 40% of employees said they feel isolated in the workplace. I would venture to guess it's significantly higher. And the lack of belonging is really, I think, what is at the root of not feeling engaged. If you're belonging to a program, some of the other engagement topics that we touched on earlier today, for example, with Dr. Ram, leading program initiatives, those things are going to come a lot easier if you feel these are your friends, these are your colleagues, this is your family that does the same thing that you're doing. And there's a really high cost to non-belonging because we have to think about trainees in terms of our future faculty colleagues, not just our colleagues in training. And when we're losing out on that important recruitment benefit, it can be really costly to our own well-being and our health and also our institution. High belonging has also shown to have really increased experiences in terms of better job performance, decrease in time off, and the employer promoter score, which is how employers decide whether or not you would recommend working there. So, for example, Google uses employer promoter score to decide how happy their employees are. How likely is it that Christine would tell Roopa to come work at University of Washington or vice versa? And that 167% increase is amazing because as program doctors, we can take away how likely are you to recruit another trainee to follow in your footsteps as a part of this residency program? How proud are you of that program? Now, even though belonging is such a big problem and we're struggling from it, not just in residency programs, but in society in general, and I think that it truly is at the root of some of the problems we have with disengagement, disintrust, and even hate. It's something that's easily fixable. We're naturally wired to engage. We're naturally wired to be social beings. And, certain things like stress and the pandemic and distance and being ripped away from our families and moved across the country for residency training harm that natural ability to be social and to be engaged. But it's easily fixable, as anyone who has stood in a bank line for a long time can tell you. You start to engage. How are you doing? Your baby's really cute. Oh, that's a cute dog. Oh, I love your purse. It's very easy for us to be social as human beings. And so all we really need to do is give each other an opportunity to do that. And so, Tana, some of those things that you mentioned, I'm going to the art festival. Does anyone want to go? I'm putting myself out there. Maybe you guys hate the art festival. Maybe you think it's really cheesy that handmade chocolates are being made, but there might be one or two people that says, I'll go with you. I have nothing going on this Saturday. And I think those kind of open invitations are really important. And it's also important for us as faculty to lower our guard a little bit. I know for myself, when I was a new program director, I was so stressed about Thanksgiving. Guess what? Nobody cares about the food. They truly don't care. People want somewhere to be. They want to laugh. They want to joke. They want to miscarve a turkey, and they want to create a memory. I think we have to put down our guard and not fall into the trap of trying to outdo ourselves and overperform as program directors and as faculty. And for me, I found that engaging other faculty in this was very important. Each one of us has maybe one or two hobbies, if we're lucky, that we enjoy doing. And it's important that we foster it, but we have 20 plus other faculty in our department. And an idea there would be, let's have a faculty sharing night. Let's, Women in Radiology tends to do this very well, but hey, did you know that Dr. So-and-so in MSK plays the guitar and was a part of a band? It's important to kind of put faculty out there and for us to put ourselves out of our comfort zone, to share our personal lives a little bit, to engage with our trainee colleagues as well. And in doing that, I think we can kind of improve our engagement. So Mike Tyson raises racing pigeons, and I don't know what other secret talents our trainees could have, but it's really important to explore those. I see one hand up, Shayna. Hey, Shayna, good to see you. She's seeing familiar faces and informal or formal, absolutely. So I think the APDR roundtables at AUR are fabulous. I know some of them are early in the morning, they're breakfast roundtables, but it's been a really great opportunity for me to be more engaged with APDR. Do any of our attendees have any comments? I will repeat those questions as well, and you can type in questions if you'd like our panelists to answer, please. Any comments on how you do resident engagement, either socially in terms of having residents engaged in program leadership, or if you're still doing resident engagement in hybrid or virtual format for readouts? Okay, absolutely. We've got one hand up. Hey, Carol, would you please unmute yourself and share your experiences? We really appreciate it. Thank you.
Yeah. Hey, y'all. Can y'all hear me okay?
Absolutely. Thank you.
I appreciate y'all bringing this up. I think everybody sort of has talked about this, and our experiences are very similar. I think the more we are just in general in person, in whatever the different facets. I'm going to focus more on what we're doing at work as opposed to the social side of things, because that you know, I think you all have talked about a lot of different things, and I agree with you. I think one thing we've noticed that is really improved, we're doing 100% in-person readouts with all levels, even the uppers. And we're doing the same as all of you. We have faculty off-site reading. They just decompress the list and read themselves. And they're not, because you all made great points that when we were doing that thing where people were pulling resident cases, some of our faculty were really good about giving the feedback and others were not. And that's a really frustrating experience for residents. I think that some of those faculty were taking for granted that an upper level resident maybe, you know, didn't care, or I don't know what it was, but when we moved really to all residents in the reading rooms getting all in-person readouts on their studies, I think it's really hard to mimic that engagement in any virtual capacity, or at least we weren't good at it. Y'all are probably way better than we were. We just weren't good at it. The other thing, like at work, and Christine brought this up a little bit, and you know, not to get too much into didactic conferences and all the issues we all have with that, but our noon conference, I've noticed, so we have a midday 12 to 1 conference every day. And I think a lot of programs have it, some probably don't, but that is kind of a nice social thing, I will say, because we do have everybody in one room. We are very lucky we're on one campus, so we can do that, but that's been good. We've done, one of the things that's been very helpful is we've had the sections doing actually more journal clubs than we used to. And we provide pizza for, if a faculty member is willing to do a journal club, we supply the pizza. And it's interesting, that's been a motivator for faculty, which probably sounds crazy. It's probably doesn't speak well for maybe us, but
food always works
at Wake Forest, so say what you will. Our faculty are motivated by food somewhat, but it's been actually a really good thing. And a couple other things that I've done this year, I've been doing it for the last 9 months, and it's been incredibly successful for engagement, is I divided the residency into 3 teams, and we're doing a monthly Jeopardy, going over, we have questions that came off the didactic conference for the month in the categories, and then I have a category that's core exam, and it just some of them are in one category that's sort of funny, like it's a get to know, what faculty members' daughters play in a band, or a category like that. So I've been doing that, and it's been it's been really interesting. It's easy to do, easier than you think. I was a little bit nervous, but it's not hard. I kind of collect the questions, I put it on there, and the prize is they're going to get a day off. The team that wins is getting a day off of work. So it's a big prize. They're very motivated. They all come, and it's been really collaborative because we've got first year, second year, third, and fourth on each team. It has gotten a little aggressive on me sometimes. One time I put the wrong score on somebody, and they're like, "That's not our team," kind of thing. I'm like, "Oh my gosh." And I'm probably talking too much, but y'all have those are some things that that Jeopardy thing is not hard to do. And I've been impressed with the collaborative discussions that are happening while it's going on. But I think, unfortunately or fortunately, any in-person things we do are probably the best things we can do for engagement. I just think it's just so hard in a virtual setting. So I probably said too much, but I was, there's some things where putting residents on teams for conference sort of activities. We're doing this Jeopardy thing. There's probably a million other things you could do that are more creative than what I'm doing, but it's been really good for conference engagement because everybody's coming to conference to try to get the questions. So there's some other builds on that we've noticed that I actually wasn't thinking. We have decent conference attendance anyway, but that's just a couple of things. Sorry, that's probably too much.
No, that's great. And don't look down on your faculty for being motivated by pizza. When we went to in-person faculty meeting, Chick-fil-A had to come back to motivate attendance. So that is a totally normal human response. Christine, I'd like you to kind of share because Carol, I think it's great that you guys are at one campus, and that was a frequent thing that I would hear from trainees that are from offsite campuses is they feel isolated that month. They feel like they can't engage in conference, especially before we all actually learned how to use Zoom and we were using some archaic video conferencing system. But University of Washington used to do, and I assume still does, all the conferences on one day to kind of facilitate people being able to come on site, to facilitate faculty being off that afternoon to do lecture. So Christine, would you mind sharing that for about 30 seconds? Thank you.
Yeah, so this is something would be really interested in here. I know we don't have time today, just what other folks are doing. So the lecture has been sort of controversial in terms of, faculty really preferring in-person lectures. They have a hard time, they feel engaging the residents virtually, giving a didactic lecture, especially virtually. Residents, on the other hand, are sort of the opposite. I think that they've enjoyed being able to just log on to their own device and watch or listen to the lecture remotely. But like Nupur said, how we do our lectures, we have a smattering of both morning and noon lectures. Right now, those are basically virtual just because some of our faculty are also remote. However, we do get the residents together Thursday afternoons. They have 2 hours of core lectures. So it's broken down by month. So this month, for example, is abdominal imaging. So every Thursday lecture, there's 2 lectures that day. They're all focused on abdominal imaging. And our residents are spread across multiple sites. So this is when they all come to our main campus. And we have a lecture hall, and that's where they come, and the lecturer is there as well, giving lecture. Now, this was changed to remote, a virtual format during the pandemic, and we're sort of taking baby steps to make it back in person. So just starting this academic year, we decided we're going to do the first 3 sessions virtually, and then the last session in person. And I think the residents have enjoyed that format. So it's sort of a hybrid format, and then getting together, sort of congregating that last session. But starting in February, we are making the move to make it all in person for every session. I haven't received any complaints on the resident side yet, but I think that even the residents who are sort of used to being able to go home during this time and log in from their couch and listen, I'm hoping that they'll enjoy getting back together every Thursday, because for us, it's the only time that all of our residents are able to sort of congregate on one day and see each other. And I think it's really good for that bonding and camaraderie. Not to mention, I think that the engagement probably with the lecturer is better as well. So I think it's going to improve learning. So to be determined, I suppose, how they feel about this once we go fully back in person. But I agree with you, Carol. I think the more in person that we can do, the better.
I agree. That's such sacred time too. And there's very little of it. And I kind of fondly remember on Thursdays, driving over there, and that's the time you get to find out, who got married and who's gone where on vacation, and who's went to go visit their family in another country. And, it's just a good time to connect with your peers and with your co-residents as well. And I remember that was one of the few times where you could always count on seeing your program director, right? So like for a lot of us that work on campuses with multiple different rotations, we might not see certain residents for weeks or for months. And that was kind of a standing appointment with the program director, maybe not like a time to discuss one-on-one items, but certainly put a face to that person who does a lot of work to keep the program sustained and moving forward. So I kind of remember the emotional impact of seeing them at that time as well, and kind of getting the updates directly from our associate PDs and our PDs. And I think being present for that, there's really no replacement. I think the hybrid and the virtual has its role in terms of clinical staffing, but I also agree with Carol's comment that the studies and the cases, I don't want to use the term wasted, but are really wasted if they're not being used in person as a teaching tool with trainees. And then there's a comment as well that we require our 1s and 2s to be in person in the lecture hall. That works really well. We've done that kind of for introduction lectures. So when you're doing like introduction to body imaging or introduction to basic chest x-ray, having our 1s and 2s on site, taking questions, walking up and, making findings, and then having ours 3s and 4s tune in, and then maybe flipping it, during board review season. Our 1s, 2s, and 3s in person and 4s virtually, or our 2s and 3s in person and 1s and 4s virtually would be another avenue to kind of balance the number of people in a room should we ever need to go back to social distancing. Any other questions or comments? That was really helpful. Thank you. Roopa, are you doing all in-person lectures?
We have this academic year, we went sort of cold turkey and just told everybody they have to come.
What about visiting professor programs? Are you guys having visiting professor programs
Yes.
or board reviews again in person this past year?
Yeah, just
Okay.
started in July, so 6 months.
Okay, so for last board review is still kind of virtual.
Yeah.
And it's expected to be in person coming this spring. Do we have any other questions from our audience? Any other comments? That was really helpful, Carol. Does anyone have any of their own experiences? What about engaging with residents socially? Is anyone a part of a program that has investment either financially from their chairperson or from GME to create social programs? One activity that I really enjoyed when I was program director was kind of doing the Day of Giving. During Martin Luther King Day, our University of Florida, the main university, would host volunteer activities. It was really easy for me as program director because the site was already determined, the training was already there was already a leader, a college student that was in charge of everything. I just basically had to provide the names of like 10 people that wanted to volunteer. So I would try to piggyback as much as possible off our main UF programs when arranging these kind of activities. I think that a lot of departments do fund some of these items. Christine, I don't know if University of Washington still does a ski day. I've never skied. I'm not a skier, but I used to attend, not just for the day off, but I think it was a good opportunity to get together with your colleagues and have hot cocoa and walk around in the snow. So I know some programs are funding it. It does take money. It does take time, like you're missing all the residents that day. But I think, when you consider that I'm remembering a memory that's 10 years plus in the past, it definitely has a lasting effect on how you feel about programs.
Yep, we still have ski day. We're actually in the midst of trying to sort out the exact location now. So this is a huge day for us. So yeah, it's a day where all the residents are allowed off service. We all get together, we go up to the mountain. You can either hang out in the lodge if you're not a skier, snowboarder, or outdoors person, and people bring board games. There's obviously food. The PDs provide some beer, and then those who are skiers, snowboarders, snowshoers are, out on the mountain. You can bring your family. And it's just a really nice, fun day for everyone just to hang out outside the reading room and bond. So it is a tradition that we're proud of, that we're gonna, keep caring for it as long as I'm in charge, and presumably, beyond that. At the UW too, we also have residents who are social chairs who help organize social activities just among the residents themselves, and they do get some funding, some support from the department for these activities. So, happy hours, they'll do this, they'll have dinners, they'll go to sports games, that sort of thing, which we're fully in support of, obviously. I mean, especially during the pandemic, this sort of post quasi-pandemic period we're in, getting them out and engaged outside the reading room, I think is really important. So helping to fund that, I think, is important as well.
I think during the pandemic, I became acutely aware also of trainees that don't have family close by. I feel like we as program directors and faculty, we have our family circle, So no matter what's going on at work during the pandemic, you come home and you've got your support circle. And a lot of trainees were lacking that. And, you know, sometimes these activities are really what you have to look forward to as a trainee that, you know, engage you with your peers and engage you with faculty and kind of bring you out of your shell. I know for me, I even had trainees that had families that were internationally located. They didn't see their family members for 2 or 3 years. And I think that really brought the pandemic isolation into focus for me. Roopa?
I just had a quick comment, Nupur. So, and maybe this is something I've noticed just this past recruitment cycle is more and more applicants now want to know this whole aspect of what we're talking about is what is the program doing to foster that sense of belonging. I've had so many applicants this cycle ask me, what intentionally are you doing in terms of outreach activities? I've done volunteering in med school or as an undergrad. Can I continue that? Will there be time? Will there be funding? So I think this next generation is very, they're very interested in knowing these things and not just how many cases can I read or how busy is call. I think this is a very important part that I've learned in this recruitment cycle is we need to pay more attention to this than we have in the past.
Absolutely. And I think we make a really ambitious promise to trainees. You know, we tell them that we have this ambitious promise that we have a lot of fun here. We have social hour, we have happy hour, blah, blah, blah. You're going to come here, you're going to find a sense of belonging. And I wonder if we fulfill that promise and how they feel once they get there. Do they feel still isolated or, you know, have we kind of met their expectations in terms of what we're promising them? Lauren has a question. Have any programs had a revised end of rotation handoff as a social hour? Tan, I can give this question to you. I love the idea. In my experience, handoff was usually the last hour of the rotation on Friday. You can go over to fluoroscopy and, you know, gather your papers and get introduced to the fluoro lead tech and good luck Monday morning. But I like the idea of a social hour. So what do you think of that idea? Have you ever kind of done it or, you know, blended that line between educational handoff and clinical work and socialization?
Yeah, I'm all for departments having more liver rounds. I have no problems with that whatsoever. Do we do it ourselves? Absolutely. We do it on a social basis with the faculty, but we have not engaged the residents in doing so. We have like we call it a supper club for the chest division. We all go out and pick different restaurants in and around North Central Florida and just kind of try something new, try something that we have not experienced. If somebody has never been to a certain Mexican restaurant or somebody has never been to a certain you know, Brazilian place, we try to go to different places each time and we rotate it around amongst ourselves to figure out which restaurant we'll choose and just to be doing something more engaging than just going to work from 8 to 5, going home and sitting in your little isolated box. So we try to get out pretty frequently. I mean, this is the perfect time of year to do something like that because it's the holidays. So people want to try to engage more during the holidays. You know, invite extra people to go out with you if you're going out to a local dinner spot or something like that they may or may not have tried, and that way you can kind of engage residents, faculty, everybody, because everybody wants to feel that sense of belonging. And I think that doing something like that, it's minimal buy-in, and certainly, like Nupur, you said earlier, it puts people outside of their usual comfort zone, but I think it has huge rewards that will pay off in the end.
I like the idea of kind of socializing it. I wonder if, Lauren, we could kind of do get a cup of coffee at 3 o'clock and go, you know, meet the fluoro techs and do your handoff to the rotation then, or do like Monday morning, first day of the rotation, coffee time or something like that. You know, I know that where I past worked at University of Florida, they would get coffee cards, and that was a really common thing. Is after the 8 to 9 teaching session at 9 o'clock. You know, trainees were allowed to have 50 minutes to go get coffee and kind of like settle into the day and walk over to other rooms and say hi. And I think they really look forward to that time. However brief it was, 15 minutes is not a really big break, but I think it would kind of reset their gears between educational, didactic, case conference time and clinical fluoroscopy, running around doing biopsy time. I think it would kind of add a little pause in their day. There is a concept called fika, F-I-K-A, which is a Nordic phenomenon of coffee at 10 a.m. It is like a religious thing. So maybe some of the audience members can kind of look into starting a fika club. I think the coffee being so popular in radiology would take off very quickly, but that's another way to kind of inject 10 minutes of socialization into the day for team building and bonding and kind of engaging your trainees. Do we have any other questions? Any comments from the audience as well are welcome. If you want to share, if you still do virtual readouts, if you're doing hybrid readouts, if you've failed in that, succeeded, you have any tips for the rest of us to learn from it, we'd really appreciate that. Feel free to raise your hand to be unmuted and speak up, please. We have only a few minutes left. If I don't see any hands, Carolyn, do you have any comments, any closing comments on this? We really appreciate you having these roundtables to get our ideas going and to give us future material to discuss at APDR. So thank you for getting us together.
No, I think, sorry, I'm trying not to take my mask off given the illness. I think you guys all had some great suggestions. I know we do a ski day, but we do it on the weekend. We don't pay for it either. We pay for lunch, but we don't pay for their own lift tickets. But I think, I think you guys have great suggestions, incorporating community service into it and just trying to do as much in person as possible. I think none of us have the right answer, and I think it's different for different programs, but I thank you everyone for all your contributions.
Thank you. I don't remember, Christine, if the ski lift tickets, I think it was a subsidized, like a discount.
They were
group rate.
subsidized. So we basically, we paid to reserve part of the lodge that cost some money. And then the food, we paid for the food, but they were responsible for and we paid for the bus. So they all took a bus up there.
Right.
Some drove, but we provided a bus for those who wanted to hop on the bus. But they were responsible for their own lift tickets. I should add that.
And I think that's kind of really important too, because a lot of times as program directors, you're like, where do you find the money to do these things? Like we all have these really cool ideas, like let's all go to Busch Gardens, but does anyone have $20,000 because the tickets are $200 a pop now? So, I think that's another thing as program directors too, is we can look for group discounts. I think residents are happy to pitch in a nominal amount, faculty and, GME. So at some institutions, GME provides funding. They provide their own activities. Even within the GME activities in larger institutions, trainees can feel lost. One option is to go together. So like UFGME used to have like Halloween night, and it would be easy to get like a group of 7 or 8 radiology trainees, but to go together. So it would feel like our own table at our event. So, some of those things that we can piggyback off other larger groups can help with the cost aspect of it. In terms of investment, I do think it's a valuable investment to put money into resident social activities, into creating social clubs, subsidizing tickets, maybe not necessarily paying all of it. I think a lot of us do feel like we spend money, or even at the training level, you want to enjoy life and you want to spend money and you want to create experiences. You're not going to take a $2,000 trip to Paris, but you would like to go to Cirque du Soleil on a subsidized ticket of $30. So sometimes those efforts may not feel appreciated, but I guarantee that they are. I think that they are appreciated by the trainees that take advantage of it. And I do think having that social chair, is it a real chief resident, social chief resident? It might be a mock title, I'm not sure, but having a resident in charge of socialization, I think is a really great way to take one more thing off the program director's plate. And having as many faculty, as many residents being in charge of stuff, even at the cost of perfection, it's definitely a plus for program directors because we cannot carry the whole program on our back. So that's a really great take-home message as well, having that social chief resident handle those kind of activities and make sure we have something fun to do all year. Thank you guys so much for attending. We ran out of time very quickly. Carol, thank you especially for all your really great comments. I loved the comments on keeping things in person. I hope we're all able to return in person, definitely at APDR. Next spring, it will be in person. So I'll see you guys then. And thanks again, Carolyn and Julie, for organizing this APDR roundtable. I'll see you guys at the next one.
Thanks, Nupur, for being a great host.
Thank you, everyone.
Bye.
Thank you.
Thanks, everybody.
Bye, everyone.